Thanks for joining us on Tandem Radio for a very special segment, By Design, focused on helping you understand how God designed you so that you may be healthy and productive in fulfilling God's purposes in your life for many years to come. Now let's join our host, health expert and public speaker, Dr. James Proodian.
Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Thank you so much for joining me today. Last week we left off with introducing a new word, which was epigenetics, and I know you spent the whole week researching that and going through that with your friends and your family. Epigenetics is, we're going to get back into that, and today we're going to take some real tangible takeaways home from learning about genetic expression and how we may be predisposed genetically to a host of diseases, but that does not mean we're going to stop trying to prevent that genetic expression to happen. So Luke 1:37, for with God nothing is impossible. And last week I gave you the illustration of holding a baby in your arms, standing up, walking across the room, and then giving your grandmother a kiss. And the transformation, the miracle, the amazing transformation of systems biology and human physiology that a two-cell baby in the womb can be born, and we're holding a baby in our arms now. Now that baby then grows into a gigantic cell of anywhere between 20 to 40 trillion cells and grows into one of us. And I find it fascinating. It's the study of science and biology and the miracles that exist. Every day, whenever I study or I go see someone speak, and last week I talked about Dr. Bland, who is just a world-renowned scientist and researcher and educator and one of my most favorite teachers. I look at the ability for our bodies to adapt, respond, repair, regenerate, rejuvenate, and even reverse chronic illness. So as we hold that baby and we realize that those babies grow into adults and adults grow into old age, we think about this amazing transformation, and my shows are designed to educate you on these transformations, not just on what happens to us, but how we reduce chronic illness. So even though we may be predisposed, let's get into the epigenetics and the basic genetic expression that are in our body, and even though we may be predisposed, like I am, to heart disease, that doesn't mean I just surrender that I'm going to get heart disease. It doesn't mean I start downing cheeseburgers and drinking big gulps. It basically means that I'm going to take a stance and take back my health and do everything within my power to not allow that gene to express itself. It's about genetic expression, and it's our job to understand that the triad of health, which is made up of physical, nutritional, and psychological health every day of our lives. We have to eat, we have to function and move, and we have to think. So that nutritional, physical, psychological, that triad of health, we want to obtain a place of homeostasis. Homeostasis is a big word for balance. It's a beautiful word. I love it. And this balance that exists between having good physical health, nutritional health, and psychological health, so that our body, we don't build that perfect storm inside of us to allow these nasty genes to express disease. And it's never too late to start applying this type of healthcare and medicine into your everyday lives, because what a mother eats during pregnancy imprints that fetus with information through these epigenetic tags. That's from Dr. Bland. These tags within our genetic code, they're there. We now, in our phase of our lives, we just don't want them to express themselves. So we have to stop thinking along the lines that years ago, medicine was that genetics were considered fixed. They are what they are, and they were unchangeable, you see. And chronic disease was thought to be a result from that genetic inheritance. James has inherited a gene for heart disease, therefore I'm going to get heart disease and die. Well, not true. Nutritional science was considered to be separate from pharmaceutical science. It's just not true. Chronic disease comes from the interaction between a person's gene, and here's the key word, lifestyle. And lifestyle intervention, which is physical, nutritional, and psychological, is the way we could allow those genes from not expressing themselves. And that is an incredibly powerful thing that we have at our disposal. And each one of us, every day, I believe needs to focus on that physical, nutritional, and psychological model and say to ourselves, we don't want these genes to express themselves. Because take a look at our society. We are living in a world of disorders and syndromes. We have gastric reflex disorder, we have TMJ disorder, low back syndrome, metabolic syndrome, fibromyalgia syndrome, chronic fatigue syndrome, menopausal syndrome, premenopausal syndrome, irritable bowel syndrome, sleep apnea syndrome, erectile dysfunction syndrome. We're filled with syndromes. And that syndrome, which leads to eventually this disease process, is this web of information that's brewing inside of us. Again, as I'm taking a lot of today's program and last program from what I recently had a chance to hear Dr. Bland speak, and just some cutting edge stuff that we use every day in clinical practice, and I'm trying to get out this information on a real practical level to the people who see me speak or listen to me. So back to the L word, lifestyle, and what Dr. Blandis calls lifestyle medicine. Lifestyle medicine is basically the emerging model. It's the emerging model for therapy of chronic diseases, to reverse them, to treat them, and not to allow these syndromes and disorders to actually become diseases. So that is the backdrop. That is the very focus of today's message to you. I only get to spend 10 or 15 minutes a week with you, and I want my message to be clear, to be based upon God's science, to be based upon design, and our fact that we've got these cells inside of us. Each one of these cells has amazing capacity to change and to replicate and to reverse chronic disease. So the 21st century, right now, what are we going to do about the chronic disease epidemics that are plaguing us, like obesity, heart disease, cancer, high blood pressure, and go down the list, osteoporosis, and the rest of them? We must look at a patient-centric focus, which means the patient and the web of information that's bio-individual to that specific person, the biochemical individuality, the bio-individuality of that individual is the first and most important thing that a doctor could focus on. Looking at it from a systems biology perspective, and the fact that our genes may have an ideology that has this built-in epigenomics of a specific disease, but we're going to do everything within our power, like I do every day, to not allow that gene for heart disease to express itself. So we need to have a patient-centric, personalized, bio-individual, not one-shoe-size-fits-all plan. It's systems-based rather than the organ has a pathology or a disease, so I'm going to treat that organ. We have to look at the systems and how they all integrate together into one beautiful, harmonious operating system, like the way an orchestra performs. And we have to look at those syndromes as a disease process that's brewing. All right, so those are the real major takeaways from today. Now let's get a little practical. Let's get into a little practicality of this and how we can apply this with some really simple health tips. So you say to me, Proodian, we started off with all of this detoxification conversation. A few weeks ago, we went through toxification and how our liver works and how the liver goes through phase 1, phase 2 detoxification. And now you introduce this epigenomics, which is the next building block, because remember, we're building a pyramid, we're building those foundational blocks. There's epigenomics about how genetic expression. Think about it. Let's be practical, boots on the ground stuff. If you read a label, if you pick up food and you can't read the names of the ingredients on that label, don't eat it. Stop for a second, digest that, right? I mean, if we can't pronounce the words of the food we're putting in our body, we may just stop and say, this is not good for me. Why? Did it come from the ground? Did it come from the plan, the design of your body to assimilate nutrients? Avoid late-day stressful behavior. It's not healthy to be on a treadmill at 9:30 at night while you're watching TV, texting your friend. Get into loving, prayer, read, listen to music, set boundaries for yourself. And when you go on vacation, when you take a vacation, please go on vacation. Don't paint the house, guys. Nobody wants to see you anyway. Go on vacation. Enhance your personal relationships. Share your life in a meaningful way with others. Get regular exercise. Strength train. Pick up weights. Build muscle. Stretch every day. And go for a massage, not when you're on vacation, but go for a massage, whether it be every week or once a month. It's a healthy thing to do to release toxins. Speaking of toxins, if you take a look at just one thing, along with overconsumption of refined processed sugar and flour, our westernized eating style consumes copious amounts of the wrong types of fats. I'm going to be getting into nutrition in a few shows, but just think about this for a second. One small bag of French fries, which I know you're not eating, but one small bag of French fries contains 10 grams of hydrogenated oil and fat. Now, hydrogenated oil and fat is horrible for us. That stays in our bodies for up to 212 days. Now, I just taught you about genes. Remember, I need my audiences to start connecting dots here. Toxicity, epigenetics, and the way genes express disease. And we don't want to put those genes in a perfect environment so they express these horrible diseases. Why would we put hydrogenated, horrible fat that comes from French fries in our bodies? See, we can do something about this. We can take back our health. One 20-ounce soda has 17 teaspoons of sugar, 250 empty calories. A kid who drinks a soda a day for a week would need to bicycle 4 hours and 20 minutes just to burn off the calories from soda. I don't know about you, but I haven't seen too many kids out biking 4 hours and 20 minutes, a week just to burn off the calories from soda. We eat over 2,000 pounds of food a year. Know what you're eating. We don't want to turn those bad genes on. Ladies and gentlemen, thank you for listening to me this week on By Design. We're getting a little passionate over here. We need to get a little worked up. We need to get even a little bit angry about the state of our health. You've been listening to By Design. I'm Dr. James Proodian. If you'd like to know more about me, please go to Proodian Healthcare at ProodianHealthcare.com. Feel free to submit any questions that you may have for me at this show. And do something healthy for yourself this week. Be well and God bless you.
You've been listening to By Design with Dr. James Proodian of Proodian Healthcare. To learn more, visit us at tandemradio.com, that's tandemradio.com, or on Facebook. And don't forget to email us with your questions. We'd love to hear from you. In the meantime, hope you have a healthy week, and we look forward to you joining us next time for more fantastic insights from Dr. James Proodian on By Design, a special production of Tandem Radio.